Hello, everyone. Welcome to the Monday Lunchtime Digest for March 2nd, 2026. It is so good to have you join us today. Have a lot to discuss with you guys, as always. First thing would like to discuss is let everyone know about the open house that Renewal Springs is having this Friday. So Friday, March 6th, they're located there at 701 North Council Road, Oklahoma City. And if you would like to check out Renewal Springs, they do detox services there. They're opening it up. They're giving tours, networking event, finger food. If you would like to attend that, then reach out to them and RSVP. I'm sure that will be a great event to be able to see what types of services and what their facilities are like there at Renewal Springs. And so we want to welcome them to the mental health community here in Oklahoma. I know that their parent company already is established here, but just having a new facility, new services is fantastic. So welcome them here. Unfortunately, we're not going to be able to attend because we have some previous obligations, but really encourage you to check out Renewal Springs and check out their new facilities there. So other things to discuss is, first of all, Senate Bill 1540. And so this was recently passed the Judicial Committee. It is now heading to the Senate for a floor vote there. And this bill, 1540, makes grooming be part of the Class B6 crimes. And so they identify grooming as befriending, establishing an emotional connection with a minor or person responsible for the health, safety, or welfare of a minor in order to lower the minor's inhibitions with the intent to engage the minor in sexual intercourse, lewd acts, sodomy, viewing lewd material, incest, etc. So if a person is convicted of grooming, then they will face a maximum term of 10 years in prison and or a maximum fine of $10,000. So that is a bill to watch to see if it ends up getting approved in the Senate and then gets passed on to the House. The next one that we're going to talk about is Senate Bill 1836. And so Senate Bill 1836, this bill requires that primary care physicians, also physician assistants, nurse practitioners, that all of them provide mental health assessments at least annually. And so the mental health assessments will be picked by the Oklahoma the Oklahoma Department of Mental Health. So they will determine what assessments those are that will be routinely given. My question is who will pay for that? Because physicians running a business obviously are going to want to know if they're required to do this. Then is this going to be reimbursed by insurance companies? Who's going to pay for this? I imagine that will be. I can't imagine that being a problem, but that will be interesting to see if that happens to come up, that they're required by law to do this, but insurance companies don't reimburse for it. Again, I'd be really surprised if that happened, but still just kind of something to watch out for. So this bill, Senate Bill 1836, and then the next couple ones I want to talk about, they are heading to the Health and Human Services Committee today at 2 p.m. So if you want to voice your support or your disagreement with any of the ones that I'm talking about, you need to contact members of that committee by 2 p.m. because they're planning on meeting there today to discuss these. Next is, we have Senate Bill 1328. So Senate Bill 1328 amends parts of the Parents' Bill of Rights. And so if you pull up this bill here, again, this is this is 1328. So if you look here, everything that is not crossed out or underlined is already part of that part of the Parents' Bill of Rights. So it's the parts that are underlined, that's the amendment, or that are crossed out. So a lot of this is already state law. and is not anything new. So I want to make sure that people know about that. I think it is good to look over this though, because there's some interesting things in it. This is something that I find interesting. Any minor who is or has been pregnant or afflicted with any reportable communicable disease, drug and substance abuse, or abusive use of alcohol, provided, however, that such self-consent only applies to the prevention, diagnosis, and treatment of those conditions specified in this section. Any health professional who accepts the responsibility of providing such health services also assumes the obligation to provide counseling for the minor by health professionals. And so this is a time that a minor can consent to treatment without requiring their parents' consent. So I find it interesting that it talks about a minor, and minor is anyone under the age of 18 years old. So what we talking about, a 10-year-old that could conceivably say that they have a drug and alcohol problem and want treatment, and that at least according to this, as I read it, are not required to get permission from the parents in order to provide that treatment. Again, do your own due diligence. If I am misreading this, then put your comments in the section here if you're watching on Facebook or on LinkedIn. Also, feel free to send me a message to hello@edmondcounseling.com, 405-440-3034. I'd be really curious to see how you're interpreting this part. Again, this is not new. This is already in the law. But as they're talking about amending the law, that's something that stuck out to me, was that piece. So again, this is Senate Bill 1328 that has some interesting changes in it that you might want to read over, and is heading to the Health and Human Services Committee today to be voted on. Next, we're going to talk about is Senate Bill 2179. And so Senate Bill 2179, this is one that requires mandated outpatient treatment. So if a person is found guilty is found guilty of a crime, and they have a mental deficit, and they're placed on probation under the jurisdiction of the court, then the court shall immediately issue an order for the person to be examined by the Department of Mental Health and Substance Abuse Services. It has to happen within 45 days. And then the person, if it's deemed necessary by the Department of Mental Health, that then they will be required to attend outpatient services. And so in this section here, let's see, they'll be required to attend outpatient services. The outpatient service provider has to give a report to the court every 6 months. And also any cost of that is on the person that is been required to attend treatment. So, this is something that I know we've seen in drug court before, people that are diverted to drug court, that their charges are related to a substance abuse issue, that they are mandated treatment, at least to participate in drug court. They're required to do treatment. And this is one that then makes this broader, so that any crime, if a mental health condition is part of that and they're placed on probation, that then they could be mandated to do outpatient treatment as part of that. So again, all of these are going to show up if you want to watch the Health and Human Services Committee today live, you can go to this website. Again, it should be happening around 2 p.m. So we have a lot of these articles that are on our Facebook page. So I encourage you to check out articles that affect Oklahoma mental health, that affects the law, and also affects our treatment of our clients. So definitely check out our Facebook page. If you're not already following it, then please like and follow us. If you follow it, then we show up in your feed easier. So please just don't like the page, but also follow it. If you're on LinkedIn, you will also see these posted on our LinkedIn page as well. So we are excited to announce that the Summer Super Summit coming up May 6th, 7th, and 8th. This is the first time that we will be doing a pre-conference on May 6th. And our pre-conference is going to be based on TBRI, Trust-Based Relational Intervention. So we are having speakers that are endorsed by Texas Christian University, which is the birthplace of TBRI, that are coming to speak for us. Ought to be really fantastic. Presentations that we're having. We're also having our own Kayla Jones, who is speaking for us. I say our Kayla Jones. She's not part of Edmond Counseling and Professional Development or the Oklahoma Counseling Institute, although she has spoken for us several times, but she is here in Oklahoma in private practice. And so you can check out everything that's happening at the Summer Super Summit at summersupersummit.com. So you'll be able to see the full agenda there. We're excited that one of our keynotes is a co-founder of Smart Recovery. So Dr. Joseph Gerstein is going to be a keynote for us one of the days. And then we also have Dr. Fuentes, who is going to be speaking on ethical mental health care for immigrant communities. Have a lot of great speakers lined up to speak this year. And so if you would like to register, then there are links there that you can click on and that you can register for the event. You can register for, 1 day, 2 days, or all 3 days. So we'd love to have you come join us at the Summer Super Summit. So then we'll talk about our new website. And so we have been working really hard on our new website. And I think, as many of you guys know, Haley Twyman Brack, who was just a core person and working with Oklahoma Counseling Institute, she's left and followed her dream of working for a game board company. And so we have been frantically working in the backgrounds to get the new website up, get the on-demand courses up. So we hope to have it up next week. Unfortunately, it's taken us longer than what we anticipated, but we want to make sure that we work out as many of the things as possible before we introduce it to you guys. Also on the new website, we're really excited about some of the new features that we have. We have a legislation tracker that is one of, if not the best legislation tracker out there. Just very visually appealing, has lots of information on it, and you will be able to go to our website and see what our different organizations are interested in as far as the bills that are in the Oklahoma legislature. So, looking at what Oklahoma Counseling Association is interested in, looking at the Healthy Minds Policy Initiative, what they're interested in. All of those are listed on the legislation tracker. And then, of course, I try to bring up as many of those things as I can during the Monday Lunchtime Digest as well. So that will be up soon, hopefully by next week, if not sooner. But we are working frantically on that. I tell you, if you were to talk to my wife, Trinity, she would attend to that. I'm working all day, all weekends for the past, 3 weeks to try to get that up and going. And I'm so sorry that it's taken so long, but hopefully it will be up here pretty soon. Also, of course, want to remind everyone about everything that we have going on at Edmond Counseling and Professional Development. So you can find out about all our services there at edmondcounseling.com. I want you to remember we have the free support groups. So you can go to edmondcounseling.com and just click the tab, free support groups, and see what all we have going on. Of course, we have Smart Recovery. We have Smart Recovery's Family and Friends. We have a chronic pain support group, and then also a relationship loss divorce support group. And so those, again, are free. A lot of these support groups are done by churches, and we're thankful that churches do these type of support groups like divorce care and things like that. But not all of our clients feel comfortable being in a church setting or want kind of a different experience. And so that's where we felt like we could benefit the community by providing these free support groups that maybe they wouldn't find in their church, such as the chronic pain support group, or that maybe they are just wanting a different experience than a church themed experience. So that's why we have the relationship loss divorce support group. So again, please check those out. Please refer your clients to them. They can attend in person or online, and you can find out more about those at edmondcounseling.com. Thank you guys so much for joining me today. If you have any questions or comments, please send me an email at hello@edmondcounseling.com, or you can call or text 405-440-3034. Thank you all for the work that you do, and everyone have a good week. All right. Bye-bye.